maybe consciously he don't understand the meaning of the touch, but his body understands. How you are touching through your finger, when you touch your finger now, patient's body will understand how much experience do you have. Okay, patient body will understand that. Trust me, this is very meaningful words. When we are touching, patient's body understand how much experience we have. So always try to listen the patients when you get the proper confidence, and 10 to 20% where I have to check first. Okay, just try to touch only that time. In the Gurukul they used to teach, do not touch the patients many times. Okay, and when you are touching the patients, you show them like you have enough confidence through your body, through your body movement, through your voice, language, everything. Then patient body, maybe very good experience. Understand? If you are little bit like this, okay, where you feel pain? Okay, I will check. Tell me where you feel the pain. If you're going like this, no. Okay, always talk little bit like, okay, I'll check on your muscle groove. If you feel anything, let me know. Okay, and try to focus first only on that point which is you really know which one is more weak. When we see, I 90% I am sure I will get the more trigger point on the vastus lateralis. So that is your first point where you will start attack. Because now if you are going to search on the medialis, maybe you will not find. Now you are searching here, now you are confused yourself. What you are doing, okay? So always go which is the more, and always go with little bit confident. Because always remember this, you knows more than patient. Okay? So when you are checking, check like proper. Okay, I'm going to check now. Flex. Okay, kick out my hand properly. Yeah, kick out. Start the kick out. You're talking with patient like this, and talk with just normals. The love will break your chain of the healing. Always remember that's very the wrong thing. When you are saying the love is healed, that's the very different subject. Okay, if the healer are a little bit like balanced one, no, they will get very good relief. If you are trying to heal the patient, oh my god, he's very poor, he's like this, I want to heal him, no, the patient's body will not receive that healing systems. Okay, fascia is understanding my fascia. If I go here now, we understand each other vibe. Many people when they are there, they understand how much confidence do you have and everything, because skin is, it's called like, skin is talking to skin. They have good for how we through eye contact we see, oh, this person is lying, this person is like that. Through the words, oh, his words is not matching with his face expressions, he is something in some doubt, in some fault. Okay, so sensory organ is very important. Sensory organ understand each other's language. Okay, we don't need to speak, they understand each other's language. Okay, so always go with your confidence. No problems. If you are in here is trigger point, if you insert needle here, there will be good relief and result. If you are not inserting inside the trigger point, inserting here, no, that will give you 10, 20, 30% really good result. Okay, but if you are inserting in the trigger point, maybe 30% extra result. Okay, so when you are inserting needle, so, and you will see the maximum time. If you don't have the proper confidence and you are going to insert needle like this, no, sometimes the fascia will hold your needle. You are trying to force the needle, but needle is not going inside the skin.
Yes.
This will happen more. So this will happen more with those people who really only, oh my god, this is this person, I am going to give the good result, and he will say, oh, this is the great doctor. That is your weak point. I used to run clinic in the Mumbai. Maximum there was like a star and this and that. They're starting not good result, good results. I have to find out what is like this. Yeah, I thought, okay, when they will come, oh my god, the superstar came to my clinic, I am too excited. If I hurt the needle, then he become like, oh, needle is too much hurting, he will not come back. And if he is coming every time my clinic, I have the good image, oh, this person is visiting his clinic. and slowly, I don't care who is coming. I have these problems, patient having this problem, I just fix this. I don't care who is he, and everything's become normal. Okay, so this one will help you to cross the skin. In starting, because of course it take time to get the confidence to start the needling. Okay, but starting if you're using this, because more the fascia contract, only the skin fascia, because skin is sensory organ, not the muscle fascia, only touch which is the skin. So if you don't have the proper confidence and patient little bit affected, oh maybe he will hurt or she will hurt, the needle not good confidence, then they contract fully fascia, and that time you will see the strength of the fascia. You are using your strength, but needle is not going inside the skin.
It will break.
Don't worry, the needle will never ever break.
No, sir. The point actually when patients
No.
come,
That is the sharpness
so my
will go.
experience.
No, sharpness will go.
Sharp. No, sir. When the patient comes, seeing the needle, he gets scared. So the whole body is tight. We'll tell him, please relax. He doesn't. And when you put the needle tip will, it'll bend.
Bend, yeah, bend. Brain, I think brain is not
break,
possible
sir,
because
bend.
in my first times when I was doing the treatment, I said, if someone's needle will break inside, what will happen? Then I take out the needle and I'm doing like this. I do thousand times. The needle is not breaking. I round all the needle, but still the needle is not breaking. I said, okay, this never will happen. Okay, so don't worry about that. This needle you can try after the after the class. Try to do this all what you want to do. Needle will not break. Okay, so find the trigger point. Okay, and cross the filament means this muscle is going like this.
Yeah.
And how will cross? You can cross like this or this too. Okay, yeah, this is the filament. The volume of the muscle is like this one. If you're going like this muscle is not that much thick. This is the more broad. Understand? Vastus latalis muscle is more broad, not that much thick. If you touch like this, bone is very you can feel the bone. The rectus femoris muscle is thick muscle. Understand? So if you are touching like here, you can go like this, or you can go a little bit these two. So which is the more, if the trigger point is more superficial, like on top, then go toward the down. If trigger point is a little bit more down, go on the top. Our target to break the more filament. Okay. Now touching here, hold this needle and put proper direction. Always in the muscle, try to insert needle around 45-degree angle. From the 40 to 65 is enough. Okay. If you are going very superficially like this, that means you are going only under the skin only. That's not in the muscles. Okay. And just prick like this. Now the needle is crossed through the skin. Okay. Then put your finger here because needle will not fall down. Okay. And now just insert little bit more deep and leave it now. Now needle is this deep, you can change the direction of the needle. Now still, because the very small filament you crossed, you can change now direction. Okay, now hold it properly and go slowly deep. You can rotate the needle and go like this. Okay. Sometime always when you are inserting, the best way to learn more in the deep, when you are inserting the needle, try to see each and every movement around the needle and try to feel each and every sensation inside the muscles through your finger. Okay. Now if there is no sensation, I can little bit more up. I am going. That is the point. Okay, just stop there. Now we have to check is there. Yeah.
Even without your voice, I could see the muscle.
Oh.
Okay.
There's a little.
So when you check very deeply, then you will understand. And trust me, when you are focusing too much in needle, patients are very impressed from you. Patient impressed too much. For example, in starting my career, I was little bit shy person. I don't have that time confidence to talk to patients. Any patient look at me and I'm doing the treatment. It was a little bit difficult for me. So what I started chanting some mantras inside my body to show the patients I'm doing some healing activity through my chanting. Otherwise, when I insert the needle, person is talking too much and they divide my focus. And I don't like when I'm doing treatment. No, I don't like any kind of like disturbance. I love to go and learn from the each and every muscles and each and every needle. Okay, so when I am inserting the needle, no, so just you can talk anything and focus on the needle only. That is your best value or your advertisement giving to your patients. Okay, dedication to your work. We don't care who is the patient. Now our patient is only this part, not the whole body. So focus just only in this area. Okay, now once touch, after 30 seconds, just try to do like this. If the patient feeling the electric shocks, pain or anything, then we'll change the needle direction. How will change? We'll take out a little bit like this. Okay, we'll not take fully out. If you're taking fully out, that when we are crossing the skin, no, only the needle is paining that much more. Okay, when we are taking out and not fully out from the skin, now we'll change the direction. Always keep your hand very light, okay, and very sensitive. No, that was not exactly. Yeah, that was point. So, huh? It's coming till here?
Yeah.
Okay. Now wait. Is it still coming?
Yeah, a little bit.
Maybe the nerve is touched.
That is good diagnosis for you, like to see there is nerve or not, because I know anatomically there is no nerve. So that is only trigger point only, okay? So yeah, for you right now it's very difficult to understand the whole human anatomy and physiology. You can do like this. If they continue feeling, you can change the directions. Okay? Now we use this one, and once we use only on the rectus femoris muscle. Okay? And go here and above the half of the thigh, right? Then we'll go here. Many time in the steep muscle also you will find it weak point. All the steep muscle is not what I said. Steep muscle is not fully steep. Yeah, I can feel here. Okay. In the steep muscle also we'll find the trigger point. When you find the trigger point, insert, go. Okay. Yeah, steep muscle will give you little bit more pain, little bit. And for example, for my personal experience, what I want to say, when we are giving example and doing the needling, that is little bit more painful. If you give me direct only patients and treatment, that is less painful, because patient's body become the more sensitive, and we are looking at all the what will happen now, what will happen now. And I am also getting scared. If we hurt more, then the student become afraid more. Oh, needle is paining. Okay, so when we are treating like one by one patients, it's not that much painful. Yeah.
I have a question.
Yeah, please.
Now it is going to not intermedialis insert like this.
No, intermedialis is little bit more deep. Okay, intermedialis is still here, the more deep. This is the superficial needle. This is 40 size needle, and I insert only 30 mm. So this is superficial. If I go more deep, and if I am crossing the rectus femoris, then that is intermedialis. Okay.
For example, I was feeling like my left leg is a little bit more weak, and then that's why you feel like the right one needs.
In this condition, you both vastus lateralis is both are weak, but left one is more weak. But rectus femoris both are stiff, because the pressure is shifting like this. When you are walking, the pressure is coming on the vastus lateralis, not able to handle the pressure, and of course the pain will go. The maximum pressure will go on the main muscle. The main muscle is the leader. If you are a boss and the three are like your worker, one is not working, you have to save your company image. Of course, you will work more extra. You will say, why we are working extra? You are just giving 10,000, and we are working for 10,000 only. That Okay, if he is not working, then you have to work because of this your company. So exactly same happen. The supporting muscle when they are not functioning properly, and when anything happen, the maximum pressure load is going on your main muscle, which is rectus femoris muscles.
So in that case, we put the needles in both the legs.
Yeah, yeah.
Yes, we
We'll
do.
insert in both leg. Okay. After this, now we'll give the electric stimulations. Can you bring the one machine?